Hello, Mrs. Arthur. I'm Nurse Gabrielle, and I'm going to be your nurse today. I'm going to close the curtains to your privacy, and let me put hand sanitizer on. Can you tell me your name and date of birth?
Mrs. Arthur, May 3rd, 1958.
Okay. So I'm here today to teach you about your new medication called Heparin and how to correctly self-administer it. The nursing diagnosis I chose for you is knowledge deficit related to new treatment for a medical condition as evidenced by lack of teaching for heparin. The short-term goals I chose for you were to you will verbalize 2 adverse effects of heparin by the end of the day. You will verbalize 2 foods or herbs you should not be taking with heparin by the end of the day, and you will verbalize 2 precautions to promote safety by the end of the day. And you also demonstrate how to measure and self-inject 5,000 units of heparin by the end of the week. Do you feel ready to learn right now, or should I come back?
Yep, I'm ready.
Okay. Do you have any cultural considerations or religious views that may alter taking this medication?
No.
Okay. So your ethnic background, gender, and age go good with this medication, so you shouldn't be any problems. Additionally, according to your chart, it says that you have ultra dexterity. So do you have anyone at home that can help you administer the heparin if your hand is not working well?
Yes.
Okay. And then also it says you have memory problems. So I printed you out these 2 sheets. So they will both help you with the basics of heparin, so you can remember and look back later on if you have any questions. And it also has pictures to show you how to self-inject if you look back later on. Okay. So the trade name of this drug is Hepaloc, and the generic name is heparin. The mechanism of action is the heparin. It inhibits the blood clotting process, and it causes blood clots to not form, and it also causes the clots to not grow. So it is indicated for your DVT and your atrial fibrillation. So your current clot doesn't grow as well. So it doesn't more don't form as well. And so your INR reaches the therapeutic range between 2 and 3. Okay. Additionally, side effects you might encounter are fever, irritation at your injection site, possibly runny nose. Adverse effects you should look out for are low platelet count, hemorrhage, osteoporosis. Okay. Additionally, interactions you might encounter are drug ones, such as the warfarin you're taking with the heparin, because the 2 combined can cause excessive bleeding. Additionally, the aspirin you're taking mixed with the heparin can cause bleeding to initiate randomly. Also, you should not be taking garlic, ginkgo, green tea, or ginger with this medication, because that can increase your bleeding risk. Okay? So the frequency you should be taking this medication is 3 times a day, which is 8 hours after each injection. Okay? And then you have been prescribed 5,000 units, which is 1 milliliter. And to measure, you're just going to get your syringe, and you're going to pull the black part directly above the line you're measuring to. In this case, it's 1 milliliter. So you're going to be administering this subcutaneously, because that was your prescription, and which is into your fat. And for the correct administration of heparin, it's typically into the abdomen. So you're going to want to do it about 2 inches from your belly button, and you're going to want to do about 1 inch of fat, and you're going to want to push it together and do a 90-degree darting motion. Okay. Additionally, other typical sites besides the abdomen that people administer heparin is the thigh. Okay. And you also want to do it interchangeably for your injections. Equipment you'll be needing is a 3/8 inch needle. That's 25 to 26 gauge. You'll be needing alcohol wipes such as these, hand sanitizer, a sharps disposal bin, gloves. You'll be needing a stuffed animal or something to practice on for the first few times, bandages and gauze. Okay. So now I'm going to teach you how to administer the heparin. So first, you put your hand sanitizer on, and you're going to put your glove on. Okay, and then you're going to get your syringe, and you're going to first you're going to get your alcohol wipe, and you're going to wipe the top of the syringe, and then you're going to get another one, and you're going to wipe the top of the injection site, and then you're going to get your syringe and put it onto the dull needle. Take it off, fill it up with 1 milliliter of air. Then you're going to put it into the vial, the air into the vial, insert the air, take it off, and then you're going to dispose it into the sharp spin. In this case, I'm teaching you with this. You're going to be teaching back, so I need to put it on here. So otherwise it'd be in the sharp spin. Then you want to get your other needle, the 3/8 inch one, take it off. Then you want to put the vial upside down, insert the needle. You want to intake 1 milliliter solution. See the black piece is above the line. Take it off, flick out the bubbles, and you want to pinch the skin 1 inch and do 90-degree darting motion. Slowly inject. And then you want darting motion out, okay? And you dispose in the sharp spin. I'm just recapping it because you're teaching later on, okay? Okay? So, for disposable sharps, typically you could use a laundry detergent bottle or something similar to put your sharps in. And then you can take it to your local pharmacy to dispose. You should never stick your hand directly into the sharp spin, and you should never recap the needle. When choosing injection sites, you should never choose a site that has redness, swelling, or inflammation. You should also never rub the injection site or pull back the plunger once it's into the skin, okay? So now you're going to teach me back, okay?
So put hand sanitizer on. I'm going to put my gloves on. I'm going to take an alcohol wipe the top of the heparin vial, and then I'm going to get a new one, wipe the injection area. I'm going to take my measuring device, the syringe, take my dull needle, take the cap off, then suck in 1 milliliter of air, take this into the heparin vial, inject the air, pull that out. Now I would I'm not going to recap it. I would dispose this right into the sharp spin, but since we're practicing, I'm going to switch to the sharp needle. Now I'm going to take the cap off. Now I'll hold the heparin vial upside down, insert the needle, and draw out 1 millimeter of heparin. Now I'll take my injection site, pinch 1 inch of fat, darting motion 90 degrees in, eject slow, pull it out, and dispose into my sharp spin.
Okay, good job. Do you have any questions?
No, I do not.
Okay, so can you name me 2 adverse effects?
Osteoporosis and hemorrhaging.
And can you name me 2 precautions you should be aware of?
Don't stick my hand in the sharp spin and never recap the needles.
Okay, can you tell me 2 herbs or food you should not be taking?
Ginger and garlic.
Okay, so you did really good. You sure don't have any other questions?
Nope.
Okay, I'll see you again soon. Have a good day.
Thank you.